My name is Scott Challoner, and you are listening to the Leaders Council podcast for the people who run the country and the people who keep the country running. It is a little bit of a brighter spring morning here in the capital today, and joining us on the show to hopefully add even more warmth and brightness to affairs is Zeenat Jeewa, the CEO of the Asian People's Disability Alliance. The APDA is a charity based in Harlesden, Brent, which provides services to meet the needs of disabled people and carers within the Asian community. Zeenat, very warm welcome to yourself this morning, and by all means, thanks for joining us on the show. It's a pleasure having you.
Good morning. It's lovely to speak with you today, Scott.
Yeah, fantastic. Now, obviously, I did mention in that introduction there that we'd hopefully be adding a little bit of brightness to affairs this morning, but the reality is we are going to be discussing some very, very serious issues on the programme, and that is a range of things that are currently sort of impacting the care industry. Obviously, the sector has been massively affected by the impact of COVID over the last couple of years, but very specifically in terms of its resources by the no jab, no job policy, which meant that all care staff had to be sort of double vaccinated to be able to continue to work in the sector. Now, obviously, that ruling affected the care industry, saw a lot of different members of staff offloaded across various providers, but was later overturned in the context of the NHS before it was going to come into force for the health service. But looking at yourselves and looking at the care industry, what has the fallout from that policy been now that it has been enacted?
Yes, so that it has quite had a huge impact on all of us in the care sector. So we've lost, a few staff members as a result of it. Sadly, very good, hardworking and dedicated staff who felt that their choice was to not have the vaccination. And yes, so we felt it, but we've also had some good retention of staff as a result of the vaccination as well. And the staff who have been vaccinated have been well and continue to provide the care as a result of it. So we've had a balance of the two. So we've had a good story and a little bit of a sadness. But so I think it's going to create more opportunities for more staff to come back. But again, it's building up that staff base, which takes time. And currently, with the numbers of people that require care, unfortunately, it puts us in a little bit of a predicament.
It does, doesn't it? And it's not exactly an easy recruitment environment for care right now. Even though there is a huge amount of goodwill toward the industry, toward the pandemic, there is still, a very kind of negative perception of the sector. And a lot of that is driven by the sort of lack of competitiveness in remuneration, especially. So we're seeing a lot of care sector staff that are exhausted, that are stretched, moving into other industries, such as retail, for instance, and they're getting more in terms of their wages. So that's also a big issue that you're currently up against, isn't it?
Yeah, absolutely. That is our ongoing situation, is that even with the staff with the best will in the world, they still need to, pay bills and survive and live. So if it's a choice that they're presented with a higher rate as a result of the poor rates being paid for care by commissioning teams, they unfortunately, even though they are dedicated to us and to the service users they provide care for, they often have to take the route of going to another job, and often it's the supermarkets who win from this situation, because they get very good staff that we have trained, we've invested a lot of time in and support with them, but they've had to take the higher paid route, which is again impacting on our ability to provide continuous sustainable care for our service users.
And I suppose in tandem with the sort of no jab, no job policy and the impact that had, I suppose even though that's been reversed now, it's not going to be as simple a case as actually bringing those staff members back into the fold, because they've probably already found jobs that have been sort of better paid and they could be lost to the care sector forever. That's the reality.
Absolutely, and these have been good, hardworking, and knowledgeable and skilled. And I think what's forgotten about the care sector is the skill that it takes to deliver. And I think it's been undervalued highly for many, many years. And it's not just the physical skills; it's the soft skills that people aren't aware of. The ability to engage, to speak to people, to support them, and provide them that interaction that maybe as somebody who's receiving the care would not see somebody in a whole day except for that care worker.
And I suppose that perception of care as a non-skilled industry, as false as it might be, the fact that that has also sort of filtered into government as well, that's also proving to be a major issue, isn't it? Because with that sort of industry perception, it's not as easy to sort of recruit from outside of the UK, because obviously the visa sort of provisions won't be there to actually bring the staff in. So you've got to look at the domestic workforce, but there's not a great amount of people from the UK that necessarily see care as the career they want to go into.
Absolutely. It's been totally undervalued at all levels, whether it's through, people's perception of care, the costing against personal care and care delivered at home has always been undervalued. And then also immigration rules around care and the role that the care worker provides has never been identified as a skilled role. And that makes it triply difficult for us to be able to recruit and retain. And the main issue we have is about retention of good staff, and then being able to get all the other of staff that could potentially be, within the workforce within the UK, but due to restrictions around who we can recruit and where the pools of staffing we can recruit from, it does very much limit us. And this has a huge impact on the actual service users. And I think that's been totally underestimated, the impact of even a missed call that can happen as a result of lack of enough staffing within the workforce across the UK. And I know that there's been thousands of cases of missed calls and then the long-term negative impact of the health of the service users.
Exactly right. And obviously you mentioned there as well that even despite the many challenges you're facing, you've managed to do sort of quite well with staff retention. So what sort of measures have you kind of actually put in place to sort of make sure that that's the case and that you've managed to keep people on board despite everything going against you?
Yeah, so as an organisation, so we are we run as a charity as well as a company and as a social enterprise. We're also all encompassing, and we are also a deaf and disabled people organisation ourselves. So we're managed by disabled people with long-term health conditions and impairments. So we understand. So what we've done is we've utilised any of our own resources to be able to retain our staff and pay them. So when they've had sick days, etc. Whereas we're not commissioned, and the local authorities who pay for the care don't often pay staff or pay for the staff time. But we will put that in to make sure that the staff are looked after, because I think if the staff are looked after, then they will be able to have that clear mind to be able to look after our service users, and the whole circle is filled. If we don't look after our staff, we really are struggling constantly to be able to then look after service users.
And I suppose there's been more of a pressing need to kind of look at the sort of physical and mental well-being of the health and social care workforce, given the impact that COVID has had. They've been stretched, they've been worked to the bone, haven't they? And quite often the resources haven't been there, meaning that they've had to take on a much sort of larger burden than maybe they would have. So that's vital, isn't it, to make sure that their well-being is in the right place? Because if your staff aren't in the right area, as you say, in that sense, then what's that going to mean for the end user, the person receiving the care?
Absolutely. I mean, I think that's what during the pandemic when we had the initial lockdown, I think everybody acknowledged the role that individuals that have played in our society, whether it's the shop workers or the cleaners or the bus drivers and the care staff, they've carried on through the pandemic. They couldn't work from home. So like the other, individuals privileged enough to be able to work from home, they carried on and they kept the country going. And I think we shouldn't forget these individuals, because they need that support now more than anything to make sure that they carry on and they're able to have their lives and pay their bills, but also do the amazing jobs that they do within our society.
Yeah, that's exactly right. And thinking as well about sort of the perception of the sector, as we talked about earlier, that is obviously a major barrier to sort of the recruitment side of things. But there has been a tremendous amount of goodwill towards our carers, given how they've sort of composed themselves during COVID, kept the country going, as you said. Do you think we can cash in on that goodwill and actually use this as almost a watershed moment to really kind of change how people do perceive social care? Because there was a big assumption, wasn't there, that the government pays for social care, it's publicly funded, but obviously people realise now that, given it's been so widely publicised, that that's not the case. So if that obviously can sort of be changed and brought into the public eye, surely maybe now is the time that we can also start to change opinion to really benefit the industry.
Absolutely, there needs to be some sea of change in regards to understanding and valuing social care, and I think that social care is the front line. It's kind of the one that prevents the long term situations where people end up in hospitals and A&E, and I think people need to kind of acknowledge it and at higher levels as well in terms of government and local authorities, and adequately fund social care so that we are able to pay staff the correct and supportive amount that they need to be able to carry on delivering that amazing care that they do, but also to be able to live their lives as well. And that needs to be a really good balance so that we are valuing them, because they're the ones that are stopping people from long-term hospitalisation. And I think that's been totally undervalued and not really given the respect they deserve.
Yeah, absolutely. And there is that circle of health and social care, isn't there, that if obviously social care was better resourced, it could actually sort of relieve some of the great burden that's on the NHS and prevent long-term hospitalisation, as you say, but it's almost being shackled by under-resourcing, and it's not able to sort of help out in the manner that it should.
Yeah, absolutely. I think the preventative method is far better, and I think that needs to be reintroduced. I think that's kind of forgotten, and we've kind of just done firefighting. And in terms of social care, and the eligibility criteria has been restricted quite in advance. So there's only people sort of who are at critical will get that intervention, and we need to kind of revert it back to looking at the preventative measures so that we don't have those extreme situations and the more costly situations that we now find ourselves.
Exactly right. And it would be remiss of me as well if I didn't touch on the sort of recent development with the health and social care levy, with sort of national insurance being increased by 1.25%. And the government sees that, of course, as the answer to sort of the social care funding crisis. Of course, higher taxes do sort of bring a whole raft of other concerns as well for people, especially given the times that we're living in with the cost of living crisis. But do you feel that this sort of, when we look in the context of the social care sector, is this a positive step in the right direction toward resourcing it properly? Or are there major concerns on your side that much of that extra funding is probably actually going to be sort of swallowed up by the NHS? And even then, they've also raised the national insurance payment threshold. So what the sector is still going to be getting is going to be affected, isn't it?
Yeah, I mean, it's kind of a very tricky situation. I mean, the concept in itself to fund it specifically is correct. The manner in which it's done is obviously still a little bit unclear and unsure, because I mean, there's obviously the concern is that those that actually are least able to absorb that cost are probably going to be hit with this levy, unfortunately. And so there's that great concern. There's definitely, I mean, good steps forward in terms of identifying that social care should be funded specifically because it needs it, and it should be ring fenced. And that my concern, again, like I think many of my colleagues within social care, is that it's grouped with NHS, and the NHS could potentially swallow up a larger proportion of what is needed within social care.
Exactly right. There are those concerns there. So, sort of in an ideal world, Zeenat, obviously just before we finish up on the programme today, over the sort of next 12 months, what ideally would you like to see in terms of developments for social care to really kind of help the Asian People's Disability Alliance really thrive in what it does and allow you to sort of do what it is that you do best to the best of your ability?
Yeah, so I think one of the key issues that we've identified is as such the floodgates have opened. So where we had the Care Act was there was an easement. Individuals weren't having their assessments, and now everybody is, I'm pleased to say, having assessments. But then I'm not sure that social care local authorities are ready for it in the numbers, and the providers probably need some support in delivering that, and it comes back to staffing. So we as an organisation have seen a quite huge increase in referrals. But again, our situation we have is the staffing. And so we do need some government support, I think, in the next 12 months to help us with that staffing issue. So whether it's relaxing of the visa requirements, so that's specifically for the care and social care sector, or there is some other measures that are put in place to try and attract more staff within social care.
Plenty to do, certainly, on the part of ministers. And Sajid Javid, if you do happen to be listening to this, please do heed that message. Zeenat, I have to say, it's been a real pleasure welcoming you onto the show today to sort of really address these issues and look into sort of your circumstances at the Asian People Disability Alliance. And I do wish you all the luck in the world in continuing to deliver those incredible services over the next 12 months and beyond. And by all means as well, do take care and stay safe with all that is still going on.
Thank you very much, Scott. It's been a pleasure.
It was indeed an immense pleasure welcoming Zeenat Jeewa, CEO of APDA, onto the programme today. And to anybody as well who might be tuning into this programme, who might feel that you have your own story to share about some of these issues that we've discussed, then you can also come to us to apply to be on the show via leaderscouncil.co.uk/apply, because we'd love to hear your story and we'd love to air your point of view. Until next time, to all of our regular listeners, you've been listening to the Leaders Council podcast with your host, Scott Challoner. Do take care and goodbye.